Good morning, everyone. Hi, I can see you are joining today. Thank you for attending this advanced training session for the use of the K-Laser on verrucas and onychomycosis. Today, we are going to watch live Dr. Simone Nardo working on patients in his clinic in Treviso, in Italy. And we are going to be able to ask him questions and learn from his experience. Dr. Nardo has been using the K-Laser for nearly 10 years. He has been working with verrucas, onychomycosis, musculoskeletal applications for podiatric conditions for a very long time, and he uses the K-Laser on a daily basis. The device he has is a cube, is a cube 4, so it's the same device that many of you have. And as you can see, we are going to show the perspective of Dr. Nardo's work from his perspective on the patient that is about to enter the treatment room. So Dr. Nardo has very kind and is, sorry, you can see around because this is the patient joining us. And we are going to, as soon as the patient is settled down, we are going to start a conversation with Dr. Nardo. Thank you for the questions you have sent us. We are going to ask the questions that you have sent over the days. Hello, ciao.
Ciao, ciao, buongiorno.
Ciao, Nardo says hello to everyone. And grazie mille per questa opportunità. Thank you very much for this opportunity of watching you work on real cases in your clinic. So thanks for opening your doors to our trainees from the UK. And this session is going to be recorded for podiatrists all over the world. Grazie mille, questa sessione verrà registrata per i podiatri e per i podologi che potranno poi vederla da tutto il mondo. Thank you very much and we really appreciate it. So let's start. We are ready. Let's start.
Yeah.
Is there anything you'd like to say? C'è niente che vuoi dirci, Simone, o vuoi proseguire direttamente col paziente? Magari l'introduzione di questo caso, se ci puoi cominciare a spiegare questo.
In questo caso,
I am going to translate.
In questo caso è una ragazza che ha una verruca plantare.
This is a young woman with a verruca.
Sotto la testa del primo metatarso, ok, è circa mezzo centimetro di diametro.
Around half a centimeter in diameter.
E è stata già preparata, pulita, adesso la colorerò.
Okay, so it has already been debrided and prepared for the laser treatment. So he's now proceeding to coloring the verruca. As you know, is important, is fundamental to actually apply black pigment to the verruca in order for the energy of the laser to concentrate exclusively on the outer layer of the verruca. This way, we will be able to control the peeling of the verruca, the treatment, and allow the treatment to be very even on the surface of the verruca and proceed layer by layer. Also, this is a safety measure because when you're using your K-laser, and if you accidentally go out of the area that has been colored with the black pigment, you are not going to burn the patient's skin. So the black pigment allows for maximum control, but also maximum safety on the use of the laser on the verruca and on the alta skin. Ok, e siamo pronti per continuare?
Adesso parto, il programma ovviamente è per il trattamento di verruca adulto.
Sì, ti posso chiedere che cosa, quanti anni ha avuto per quanti anni ha avuto, quanto tempo ha avuto questa verruca? How long has this patient had?
Qualche mese, da marzo mi diceva.
Okay, this is a recent verruca. It's only a few months. The patient had it for only a few months. And c'è qualche altro trattamento è stato fatto per trattarla prima del laser?
No, non ho mai fatto niente, è il primo trattamento che fa.
Ok, this is the first treatment.
Perché pensavo fosse un callo, ma invece pensavo fosse un callo, invece
Okay.
abbiamo riscontrato che è una verruca.
Okay, so originally presented, it looked like a callus. So when the patient went to see Dr. Nardo, he realized it was a verruca. So he simply debrided it to prepare it for the treatment. The debridement allows you to properly see the size of the verruca, to understand its edges, where the exact size. So we advise to always debride it slightly if necessary. Many clinicians, many podiatrists don't actually debride it and they just use the laser right away. But if you want, if you think it would be beneficial for the individual case that you are about to treat, to expose the verruca better, go ahead and debride it. Just make sure that you do not make it bleed. Okay, if it bleeds, apply some silicate to ensure that it's not going to bleed during the treatment. Just apply it, wait for a minute or so, and allow it to dry before you continue the treatment. But the verruca should not bleed as you perform the laser treatment. Ho appena detto che la verruca non deve sanguinare, quindi quando fanno la pulizia con il bisturi, non devono stare attenti a non far sanguinare la verruca, giusto?
Sì, se è possibile, sì, ovviamente. Bisogna procedere un po' alla volta, togliendo strato per strato, sì, a livello come procedendo in senso circolare, okay, in modo da verificare dove si riesce ad arrivare con, sì.
So we will proceed
il trattamento. Questo è un primo trattamento, la verruca è grande, probabilmente non si riuscirà a toglierla tutta, okay, dipende anche dalla sensibilità della persona.
Okay, so exactly, we are going to treat as much as possible today. The treatment might require a touch up later on in a second session. And se la verruca sanguina durante il debridement, che cosa devono applicare loro? Che cosa devono fare se accidentalmente la fanno sanguinare?
Possono bloccare con un po' di nitrato d'argento.
So yes, so in case if it bled accidentally, you make it bleed, some silver nitrate, apply a drop of silver nitrate and just let it dry for a couple of minutes before proceeding, so that the verruca will not be bleeding as you apply the laser treatment. We are about to start now.
Allora, partiamo con una potenza che non supera i 10 watt.
Okay.
Io solitamente utilizzo un time on attorno ai 50-52 millisecondi e un time off attorno ai 18 millisecondi. 18,
ok, dammi un attimo per tradurre. So we are going to start with the verruca, for the wart adult setting, which uses about 12 watts of power. And normally, Dr. Nardo uses a time on of 18 seconds and then time off of 52 seconds. 18 secondi per il time on e 50 per il time off, giusto?
Millisecondi, sì.
Millisecondi. So it's actually, yes, so it's, as I said, 18 milliseconds for the time on and 50 milliseconds for the time off. That's what he starts with.
Okay, now we start. Non usiamo l'aspiratore per...
As you can see, we are forming the smoke forms during the treatment. It is supposed to be there to happen. Excellent. So you can see how precise and accurate the treatment can be. We can really treat every single spot in a very precise and accurate way. You can see that now is moving in lines. He started with a few individual blasts to assess the patient's tolerance to the treatment. You can see the patient is comfortable, and now he is moving a little bit faster in lines, so that it's going to cover a longer distance with every single blast. As you can see, the patient is comfortable. So the patient is saying that she can feel a little bit of warmth, but is not painful. So, as you can see, is progressing with treating.
Non abbiamo usato nessun anestetico.
Non ho capito, scusami.
Okay.
Non ti ho sentito.
Adesso vedo se il tessuto è buono per poter ancora.
Okay, so he's now proceeding to remove the darkened tissue on the top to assess what the underneath tissue looks like.
Okay. Bene. Ricoloro.
He's applying the pigment again.
E continuo. E riprendo. Sei? Sì. No.
So the patient just said that she can now feel it because most so she can now feel the warmth of the treatment. So she, Dr. Nardo has now reduced the power. Di quanto? Di quanto ha ridotto lei?
Mezzo watt.
So he reduced the power by a half a watt. Now 1 watt down.
Perché il nucleo comincia a essere più sensibile al nucleo della verruca. Il nucleo? Il centro è più sensibile, quindi va meglio? Sì, posso.
Cosa sta applicando adesso?
Adesso siamo arrivati nella parte centrale, nella verruca.
Non ti sento. Che cos'è questo prodotto? Acqua ossigenata?
Sì, acqua ossigenata e betadine.
Ok.
Per disinfettare.
So now the treatment is almost
Betadine.
So he applied some disinfectant first and now some betadine treatment.
Ok, come primo trattamento adesso ci possiamo fermare.
So the treatment is now over. As a first...
Siamo arrivati nella parte più importante, ne faremo un secondo in quanto la verruca, essendo bella grande, necessita di essere ritrattata una seconda volta.
Okay, so the treatment will be performed again a second time, and so this is the first one, and there is going to be a touch up as the tissues heal.
Okay. Adesso io faccio disinfettare a casa con betadine per una settimana e poi la rivedo.
So he's going to see her again in a week time, and the patient will continue just disinfect it and apply some betadine treatment over this week. He's applying a dressing just to keep it nice and protected. And I'm going to ask the patient how painful was the treatment. Salve, buongiorno, vorrei parlare con la paziente. Quanto è stato doloroso il trattamento? In una scala da 1 a 10, dove 10 è il dolore peggiore che abbia mai provato.
4.
So grazie. So the treatment at worst was 4 out of 10 when the treatment was almost over and the verruca was almost completely removed. So obviously at the beginning, the treatment is not painful because the verruca is still there, but as we peel it off, it gets removed. And the treatment, the energy that is applied to the infected tissues travels through and can reach the lower layers that are actually healthy, and those are going to pick up a little bit of heat.
Bene, ci prepariamo, vedo un attimo di preparare un'altra verruca adesso.
Perfetto. Mi chiedono quanto spesso tratti verruche di questo tipo? Ogni giorno?
No, almeno 2 o 3 al giorno.
Okay, he treats at least three verrucas a day using the laser, at least 3.
Però ogni reazione è diversa. Cioè, alcune si riescono a togliere completamente in una volta, altre 2 o 3 volte. Dipende un po' dalla vascolarizzazione e la grandezza della verruca, ovviamente.
Ok, grazie.
Tutto per non far soffrire i pazienti.
Some verrucas can be removed in one session. Other verrucas require touch-ups, and depending on the size of the verruca and the vascularity, how vascularized is the area. Another question coming in for this patient: how many times and when should she come back? She's coming back in a week time to reassess, and probably there is going to be another treatment, but then if necessary, they can come at later times. Mi chiedono, quindi tra una settimana soltanto la rivedi?
Antonella è uscito un attimo per l'altra paziente, sì, di solito fra una settimana poi lui ritornerà a vedere com'è la paziente e valuterà la terza volta di solito, ma solitamente dopo 2 volte è già risolto il problema, dipende come si ritrova, diciamo, lo stato della verruca.
So they're telling us that the patient, yes, they're confirming that the patient will come back next week, in a week time. But again, every individual case is assessed individually. So they are going to, Dr. Nardo decides based on the state of the verruca, the size, the individual case, when they are going to be treated again. But normally he sees them again in a week time. Other podiatrists wait a little longer. Some podiatrists wait 3 weeks and for the second session, and then they later on they can see the patient again a third time purely to see how things are progressing, and at any time, so it could be 6 weeks later. But the treatment, the main treatment is on day 1. Then we have a touch-up, and then, if necessary, a third touch-up. But most of the verruca is removed on day 1. And many cases, in most cases, 1 session is enough if the verruca is small enough. If it is larger, it will require multiple touch-ups. So, okay, so Dr. Nardo is now calling in patient number 2. We are waiting for patient number 2.
Ci sono I soliti tempi anti-Covid, quindi dovete portare pazienza.
So the patient, they are, because obviously there are COVID measurements in place, is going to take a minute for to ensure that everything is disinfected and that everything is ready for the next patient. Cristina, possiamo far vedere che disinfettiamo la sedia per piacere? Il laser. Okay, do you have any questions? If you want to ask us something, there is you can write in the chat box or in the Q&A. Actually, the Q&A would be the more appropriate box to use. So they are now, as you can see, they're disinfecting the equipment. Should you have any question, please use the Q&A. So how did the Dr. Nardo debride the verruca? He uses a scalpel, just a scalpel. I'm going to ask him when he comes back, but I know this already. I've been trained myself at Dr. Nardo's clinic, and I'm already familiar with his setup. But of course, as he comes back, I'm going to ask him for confirmation.
Nell'attesa, Antonella, ti posso far vedere l'ultimo trattamento, il tornato, come ha modificato il software, quindi aumentando la potenza e diminuendo a volte il tempo, sì. O viceversa, a seconda della problematica, no? Quindi quando la paziente avevo visto che ha avuto un leggero dolore, il dottor Nardo in pratica abbassato la potenza di 1 watt. E già con 1 watt la paziente si sentiva meglio, quindi è riuscito poi a continuare il trattamento.
Okay. So what Mrs. Cristina Oliva is doing, she's the equivalent of me in Italy. She's the person that trains podiatrists and physiotherapists in the use of the laser in conjunction with Dr. Nardo and other specialists that have been developing the K-laser treatments. Cristina was just telling us that the patient, they always start with the standard setting that the device offers, either verruca adult or child, wart adult or wart child, and then they adjust the power or the time on and time off based on the patient's tolerance of the treatment. If the patient is comfortable, and they are most of the time, you can also increase the power. You don't need necessarily to lower it. You start lower it when and if the patient shows some discomfort because the treatment is becoming hot. Dottor Nardo, mi chiedono che strumento ha usato per fare il debridement, per pulire la verruca prima di iniziare.
Noi utilizziamo...
Hai usato lo scalpel,
sì.
il bisturi?
Bisturi.
Yes, he uses the scalpel to debride the verruca prior to starting, if necessary. So the questions are coming in. So hello Antonella, I have 2 clients with verruca and big corns. Do I descale the whole corn first or just concentrate on the verruca? Ok, so dottor Nardo, ci chiedono se la verruca si trova all'interno di un corn, di un callo, un corn, che cosa, se scali, se rimuovi tutto il corn o se ti concentri soltanto sulla verruca?
Beh, solitamente il callo è più esterno rispetto alla verruca, quindi prima rimuovo il corn e poi vado sulla verruca.
Sì. So remove the corn first and then proceed to treat the verruca directly, because obviously the corn will block you the site of the verruca, so you need to remove that first. Now Dr. Nardo is going to start the treatment of the next patient.
Sì, questo è un trattamento di 3 verruche, il secondo trattamento di 3 verruche.
So today is the second session for this patient who has been treated one time before, and they present 3 verrucas.
Secondo e ultimo perché sono rimaste proprio piccole.
Yeah.
Vi faccio vedere quanto grandi sono adesso.
Sì. So this is going to be the last session because they are really tiny now. So it's just, as we said, it's a touch-up.
Ecco qua. Verruca mosaico.
La famosa verruca mosaico.
So this is a little mosaic verruca, and we can see that there are 3 tiny dots. They're close to each other. Also, just want to remind everyone that there is a cameraman actually filming in real time, and they're taking pictures as well. So once you see the final recording, you will be able to have a much clearer image of the verruca. I appreciate it's very small now. Grazie, sì, possiamo proseguire.
Bene. Allora, partiamo questo un po', sempre un po' verticale, ma con questo una volta è molto più basso, non senti poco adesso un po' più sensibile perché arriviamo a una parte più. Ok? Siamo un po' più vicini.
Muy quanto dolce.
Bene, come potete farglielo vedere? Ho finito, posso?
Sì, sì.
All right.
Ho finito.
Yeah.
Con questa ultima pulizia le verruche sono state eliminate del tutto. Infatti non ha sanguinato, siamo arrivati sotto il livello dermico, il tessuto è buono.
Ok.
Un
attimo.
Col secondo trattamento sono state...
Ok, allora un attimo lo traduco. The treatment is completed now. The verruca has not bled, and he has reached the dermal layer, and the tissue looks good, and the treatment is complete. So the verruca has been fully removed with 2 sessions.
Bene. Grazie.
Grazie.
Bene, io direi che possiamo avere una pausa, basta, va bene? Sì.
Adesso arriveremo alla terza paziente, ci sarà un attimo di pausa. Ok, Antonella, e disinfetteremo la postazione e vedremo l'onicomicosi. Ecco, vedremo l'onicomicosi e così concludiamo questa sessione di training.
Abbiamo delle domande adesso anche da fare.
Sì, hai delle domande?
Sì,
ok, allora adesso è disponibile. Grazie, ciao.
Ok. Eccomi qua.
Allora, un attimo adesso chiedo le domande. Mi chiedo, prima di tutto mi chiedono, tu usi l'estrattore per il fumo durante il trattamento?
Sì, ce l'abbiamo qui, non l'abbiamo acceso oggi perché fa rumore di sottofondo.
So, Catherine, regarding the question regarding the fume extractor, the normally he would have the fume extractor on for large verrucas, for a lot of work, but today it was off because it's noisy and it would not allow the audio to be good enough for hearing his answers when we ask him questions. So yes, depending on the size of the verruca and the work that you need to do, this extractor can be on, or if it is small enough, you can just open the window and that's enough.
Non userete l'accessorio del Cube perché sai che sono accessori dedicati al Blue Laser, però in questi casi si possono abbinare con il carrello e l'estrattore dei fumi, in quanto abbiamo visto che i podologi insomma ne hanno bisogno in questi casi se non hanno un altro estrattore di fumo.
Okay, so the stand that you are seeing now that Dr. Nardo has is the stand that normally comes with the blue laser that you will get for if you have a blue laser, which is the device that is used for dermatological treatments, for skin treatments, and for also verrucas and onychomycosis. But if you want, you can have a smaller extractor, of course. So I'm going to check all the other questions. Just a second.
Aspettiamo adesso l'entrata della paziente con onychomicosi, ci aspettiamo qualche minuto.
So I'm going to ask Dr. Nardo the questions as soon as he comes back. He's now receiving the next patient, and I am going to. So one of the questions is, could you please confirm the verruca time setting? I think the default setting we've used higher than 18 milliseconds on and 50 milliseconds off. So that's the setting, but you are absolutely free to use the setting you think time on and off based on what you need for that individual case. So the device, as you know, comes with presets, and our advice always is start with the presets as they are, and then you adjust the power and you increase the power based on the reaction to the treatment and based on the individual verruca. You increase the power or decrease it, or you can leave the power as is and increase the time on or decrease the time on, or increase or decrease the time off. This allows you to have full control over the progress of the treatment. Sometimes you need, if you're using you have a larger verruca, you want to keep a power up, but to make the treatment more bearable, you can reduce the time on or increase the time off. So the K-Laser allows you full control over the treatment as you perform it in terms of power, duration of the blast, duration of the cooling phase between blasts. So, but typically you can start, most treatments are just done with the settings as they are.
Allora adesso trattiamo l'onychomicosi. Io ho lasciato l'onychomicosi in vis completa con l'unghia. Non so se si vede.
Questa parte, così vediamo qua. Si vede Antonella?
Yes, sì, possiamo vedere, e non si vede molto bene, la qualità dell'immagine ovviamente è bassa.
Comunque questi video verranno fatti e pertanto poi vedremo una qualità più alta.
Grazie. So at the moment, we can't really appreciate the details of how the onychomycotic toenail looks like, but as the cameraman is recording this session with a high quality camera, we will be able to actually see, when we have the final recording, we will be able to see more details. We are also taking pictures, as you can see now. And we are going to have a better understanding of the details with the actual pictures. Puoi darci qualche informazione su questo particolare paziente? Quanto tempo ha avuto l'onicomicosi e che trattamento?
Allora, questa onicomicosi è da qualche mese, sempre verso inizio anno, mi diceva.
No, ma sono diversi anni che la porto dietro.
Aveva cominciato diversi anni fa. È venuto da me.
Nardo, Simone, dammi tempo di tradurre. Dimmi una frase per volta, io traduco
Sì, scusa.
la frase.
Io l'ho vista l'altro giorno. La signora dice che è anche un anno che ha questa micosi.
Okay, so the patient has had this mycosis for over a year, and but it's a new patient to Dr. Nardo. They met last week, and they just decided how to proceed, how to tackle this case. So this is the second time they see each other, and the first K-Laser treatment for this onychomycosis. Che altri trattamenti sono stati fatti su questo paziente prima? What other treatments has the patient done on this toenail?
La signora aveva provato con i trattamenti locali, antimicotici locali, aveva provato da sola.
Okay, so the patient has tried several antimycotic treatments that can be bought over the counter in pharmacies, and they didn't really succeed. Hanno funzionato? La paziente ha potuto notare un miglioramento o non è cambiato nulla?
No, per quello viene qua per fare il trattamento laser.
Sì. So no, the over-the-counter products did not work on this toenail, and that's why she resorted to seeing Dr. Nardo.
Bene, adesso io procedo con l'asportazione della parte intaccata da micosi.
Ok, non ho capito, scusa, cosa fai?
Taglio la parte di unghia più possibile intaccata da micosi, ok?
So he's now proceeding to cut off, to remove the infected toenail as much as possible.
In modo da esporre il tessuto al trattamento.
Okay. So he's removing as much as possible the infected part. Sì. And Cristina, mi dicono che se puoi mettere il vostro schermo a pieno schermo, perché in questa maniera, non lo so, mi stanno dicendo di fare questa cosa sul vostro...
È pieno schermo.
È a pieno schermo e di selezionare View Gallery, la galleria in alto, e di assicurarvi che il vostro schermo sia il principale. Non lo so, mi stanno dicendo questo gli altri. Steven mi sta dicendo questo.
Sì.
Ok.
Bravo.
Un'altra domanda che mi hanno fatto riguardo la verruca, Simone, mi chiedono se hai mai usato una crema antidolorifica.
Estetica.
Se usi qualche analgesico, qualche crema analgesica.
Sì, oggi non ho voluto usarla per far vedere la sensibilità delle persone al laser, però ogni tanto faccio mettere eventualmente un po' di anestetico locale mezz'ora prima.
Okay, so for treatments that might be painful, like the Verruca treatment on a sensitive patient, Dr. Nardo does advise the patient to apply some local anesthetic treatment like Emla cream, before coming to the laser session. So it could be half hour or an hour, depending on the sensitivity of the individual patient. Okay, we are now ready to proceed with the so now filing down the toenail.
Adesso si vede bene, Antonella?
Sì. Yes, we do. We can see.
È anche una questione di luce, sai, nella stanza.
La camera, la qualità della camera purtroppo è un po' morbida. Il video è un po' morbido, non è molto nitido, ma non c'è problema. So we were discussing the fact that you can't appreciate the details. At least I can't. I'm not sure whether you can, but you can't quite see the details of how the toenail looks like. But as I said earlier, we are going to provide with the final recording, the final editing of this training session, you are going to be able to appreciate how the toenail looked like before the treatment. As I said earlier, if you have any questions, please write them in the Q&A box. So Nardo is still filing the toenail to prepare it for the treatment.
La pulisce molto bene, si vede bene. Bene.
So it is fundamental, obviously, to do a proper preparation to clean it up properly.
Sta anche diversi minuti.
So, sì,
Questa è la qualità dell'unghia prima di trattarla.
So he's been fine. How long does he like to spend using it?
Ok. Adesso possiamo partire con il trattamento laser.
So Dr. Nardo is still filing the nail, is still preparing it.
Adesso a posto.
The nail is ready.
E adesso possiamo partire con ORL, trattamento manipolo ORL.
Quindi non stai usando l'High Energy Head, la testa, l'ENT.
Chirurgico no.
No. Conviene sempre pulire prima e poi trattare direttamente con l'ORL. Il chirurgico a noi podologi per l'unghia non serve perché abbiamo micromotori e turbine che ci aiutano a preparare l'unghia.
Okay, so in this particular case, he's progressing directly with the ENT piece that is also used for wounds, small wounds, for and for onychomycosis. So once the toenail has been cleaned as much as possible, he's not going to use, in this case, the high energy head. And he's just going to use a treatment that allows the toenail to, the nail bed to be stimulated to stimulate the immune response and to attack any remaining fungus that can be there. Tu quindi fai questo trattamento, qual è lo scopo in questa fase usando, che cosa vuoi ottenere?
Cerco di eliminare la parte ungueale
Mm-hmm.
intaccata dalla micosi, in modo da arrivare al letto ungueale, pulirlo il più possibile e poi poter fare il trattamento laser con RL che va a creare una disinfezione a tutto il letto e una stimolazione alla ricrescita ungueale.
Sì. So what he's...
mi evita il problema di dover tirar via col chirurgico la parte ungueale.
Ok, ok.
Dobbiamo trattare la micosi, non trattare l'unghia ormai intaccata da micosi.
Okay, so in this case, so he's going to treat the toenail bed with the these ENTPs, which I appreciate not everyone in the UK has. It's another tool that you can use for your onychomycosis treatment. This is a head that if you want, you can purchase through us, but you can also try and reduce the zoom on your standard therapeutic head all the way down to 1. And that would concentrate the energy on a tinier spot. This head is more accurate, is more precise, but at the same time, the other, you can try with the therapeutic head to spot 1 too. So puoi cominciare se vuoi, sì, grazie.
Grazie.
So the aim of the treatment in this case is to treat the toenail bed, to recruit leukocytes to come and disinfect and clean up the infection in the toenail area, in the toenail bed, sorry.
Mi muovo sempre perché potrebbe surriscaldare troppo il tessuto, il letto ungueale.
So he keeps moving all the time because he doesn't want to overheat.
Il paziente lamenta, poi calore, mi fermo un attimo.
If the treatment becomes too hot, he can just take a little break, wait a few seconds to allow then the area to cool off and restart the treatment. Noi non potevamo vedere la dimensione dell'infezione in questo caso, era l'intera unghia che era compromessa o soltanto una parte?
Quasi metà unghia.
So half of the toenail was compromised in this particular case. Però tu tratti l'intera unghia, giusto?
Ma no, col laser mi fermo nella zona interessata qualche millimetro al di sotto della zona di pulizia praticamente.
Sì. So he's concentrating on the area where the infection is with this setting. Il trattamento che hai usato è ovviamente onicomicosi con la standard therapeutic, con l'icona della testa terapeutica, giusto?
Sì, sì, sì.
Quindi non hai usato il programma onicomicosi con il manipolo ad alta energia?
No.
No.
Okay, so in this particular case, Dr. Nardo used the onychomycosis protocol that features the therapeutic head. So with this particular head, you only use the therapeutic head protocol for the onychomycosis. As you remember, on your device, you have two. You have an onychomycosis protocol with the high energy head and another one with the therapeutic head. So when you're using this particular head you're seeing at the moment, you use the therapeutic setting. Ok, puoi proseguire?
Faccio una seconda terapia, solitamente 2.
Okay, so he started the protocol again, and he does another pass. And as you may remember, the therapeutic treatment is about 2 minutes long. And so in this case, he decided to repeat it twice. Obviously, an accurate assessment of your case, of your patient, is fundamental to understand how to apply the treatment. The K-Laser is a tool in your hands, but you are the one that decides, assess, and strategizes the treatment. So in this case, this is the way Dr. Nardo is proceeding. We also often recommend to use the therapeutic head all over the toe. So to increase circulation, to recruit, to activate the immune response, to maximize the oxygenation of the tissues. We know that this is beneficial for the overall metabolism of the tissues. So in this case, we are concentrating on the toenail, but especially in patients affected by poor circulation, ischemic patients, diabetic patients, elderly patients, in any case where you suspect that the circulation is compromised, we recommend using the therapeutic head all over the toe, all around it, on the plantar side as well, and to also cover part of the metatarsal area leading to the toe. Of course, every case is different and is approached in a slightly different manner. Noi consigliamo sempre di usare il trattamento terapeutico con la testa normale, la testa terapeutica, tutto intorno al dito che viene trattato, quindi non soltanto sull'unghia, ma anche sul resto del dito, per incrementare la circolazione, aumentare la vascolarizzazione e l'ossigenazione dei tessuti intorno all'area infetta.
Sì, attorno alla matrice va bene.
So Dr. Nardo, yes, confirms that he does that as well. That's it, the treatment is finished. He applies some betadine to keep the area nice and disinfected. And he is applying some dressing to protect the treated area. Per quanto tempo deve tenere il dressing, deve tenere le bende il paziente su quest'unghia?
Un giorno, fino a domani.
So tomorrow the patient can remove the dressing and that's it. Devono riapplicare.
Se è sensibile può metterla per qualche altro giorno, se la parte è un po' sensibile, sempre con del betadine.
Ok.
Altrimenti in questi casi non ci sono ferite, pertanto può anche rimanere scoperta.
Okay, so if the area is sensitive, or if the toenail bed is exposed, the patient can apply some more betadine and dress up the toenail, the toe, apply dressings for a few more days until the lesion is completely healed, and yeah, always applying disinfectant. But if there is no exposed lesion, if the skin is intact, then the dressing is on just one time, just for one day, just purely to ensure that the area is nice and protected. Quando mi chiedono quando decidi di usare, qual è la discriminante per usare e per rimuovere l'unghia completamente, o quando è che invece usi soltanto il laser? So when do you perform?
Dipende quanto la micosi ha intaccato il letto ungueale.
So
è più superficiale, faccio un debridement superficiale e poi tratto direttamente con laser. Altrimenti, se l'unghia è scollata dal letto ungueale, la sporco tutta.
So if the toenail is detached from the toenail bed, then he performs toenail avulsion and he treats the toenail bed with the therapeutic setting. If instead the toenail bed is not completely compromised, or the matrix of the toenail is not completely compromised, he proceeds on with the laser without performing toenail avulsion. Quando...
Scusami, facciamo uscire la paziente, poi fai le domande a Nardo, se no non teniamo troppo qui. Grazie.
So the patient is going to leave the room now, so they will let the patient go, and we're going to ask Dr. Nardo a few more questions.
Grazie, signora.
Allora, un secondo, Antonella, che adesso darà delle indicazioni alla paziente su come diciamo, trattare la sua unghia a casa, e tempo un paio di minuti e ritorna qua ed è disponibile per le domande.
Okay, grazie. So they are now proceeding, giving advice to the patient on what kind of care they need to perform at home, and they are going to, so they're just going to educate the patient on the correct maintenance and cleaning of shoes, slippers, socks, to ensure that contaminated surfaces don't come in contact with the foot again. So I am reading, I'm going to read the questions now. So the first question is, how do you know when stop filing? Mi chiedono quando è che decidi che ridurre l'unghia è sufficiente perché il trattamento laser sia efficace. Quando tu prima stavi stavi riducendo l'unghia con l'apparecchietto, e quindi volevano sapere quando decidi che è sufficiente, che non serve più ridurre l'unghia, perché quello che rimane può efficacemente essere trattato con il laser.
Io riduco l'unghia intanto che vedo il tessuto sano praticamente.
Okay, so he keeps filing the toenail until he sees that the toenail tissue appears healthy. So he keeps, if the infection is superficial, he just files down the nail until he sees healthy toenail tissue. Un'altra domanda: if the mycotic nail is very thick and brittle, making it difficult to reduce, is it therefore not suitable for the laser treatment? Quindi mi chiedono se l'unghia è molto doppia e si spezza, si sfalda, ed è difficile ridurla con l'apparecchio che stavi usando prima, la reputi non adatta al trattamento laser?
No, allora in quel caso posso aiutarmi col chirurgico per arrivare il più possibile a una pulizia della parte cornea.
So in that case, if the nail is very, very thick and brittle, you proceed by removing as much brittle tissue. So you file it down as much as possible, and then you progress with the high energy head, which you can see now on camera, and you perform the treatment with the high energy head.
E dopo faccio il trattamento poi.
And then he always repeats after the treatment with the high energy head, he progresses using the head, as you have just seen. You just remove the head as usual and use the therapeutic head instead. Okay, so I'm going to read so un attimo solo che sto leggendo le domande. Just a second, because I'm reading the questions as they come in. Okay, so Jan, I'm going to answer your questions because they don't pertain the treatments. I'm going to ask your questions separately, and I am going to read the other questions on the chat in the chat box. Let's see. Okay, so they are asking how many treatments do you perform? We're asking how many treatments does he perform on the same patient when the patient is called back in for a second session. Quindi mi chiedono, hai fatto il primo trattamento, quando fai tornare il paziente?
Io faccio solitamente 3 trattamenti ravvicinati, 1 a settimana.
Okay, so he typically performs 3 sessions in a row. They can be once a week maximum. So they can be every other day or every 2 days, but no more than once a week. So they need to be close to each other. Noi gli consigliamo spesso di fare i trattamenti 2 o 3 nella stessa settimana, se possibile. Massimo, come dici tu, massimo una settimana. Ok, so yes. E poi
e poi un controllo al mese.
And then he checks.
Un richiamo al mese.
Scusami?
Un richiamo al mese.
Ok, e quindi tu fai un solo trattamento al mese dopo o altri 3 trattamenti?
No, 1.
Okay, so he typically needs to 1 more session about a month later. That's normally enough. He reassesses them 1 month later and performs another treatment. So he is very good at his job. He is a very experienced podiatrist using the K-Laser. So typically 1 single session is enough 1 month later. But we know that you can perform the cycle again. If 1 session is not enough, you can perform it other 2 or 3 times. And then you assess again 1 month later. Quindi spiegavo, tu ovviamente sei molto bravo e ti basta un singolo trattamento il mese dopo, però ci sono quelli che stanno imparando che magari debbono fare un altro corso di 3 sessioni in una settimana. But yes, obviously, because he's very experienced and he's very good at it, he just 1 session after 1 month after the first cycle of 3 sessions is enough.
Antonella, abbiamo esaurito il tempo perché adesso ha altri pazienti. Se riusciamo, non so se hai qualche ultima domanda, poi nel caso le scriviamo e poi possiamo rispondere man mano.
Perfetto. So they are telling that now the next patient is arriving, and they are not patients for our advanced session, so he has to move to the other patient. So if you have any questions, please ask me now. Otherwise, we can just write them, and he will reply to me, and then I will translate it for you, and I will the answers will be featured in the final recording. So is there any other question that you want to ask? Io gli ho appena chiesto se ci sono altre domande che ti vogliono fare. Una domanda: quanto successo hai con le onicomicosi? Quanti sono i casi dove sei costretto a ripetere il trattamento a lungo?
Dipende come arrivano.
So,
ci sono casi che vanno avanti anche 1 anno, 6 mesi e 12.
Sì. So depending on the severity of the infection, the treatment may need to be repeated several times. It can take even 6 months if the patient arrives and the toenails are completely compromised, there are several toenails are infected, it is a very, very severe case, it will require multiple sessions, multiple courses. So obviously it all depends on the case at hand. Dicevo sì, che dipende chiaramente da quanto è grave la presentazione dei sintomi. Ci sono dei altri trattamenti che tu consigli di usare in concomitanza con il laser durante il periodo del laser? Per esempio, non so, probiotici per rinforzare il sistema immunitario o trattamenti topici che consigli?
Sì.
Aspetta, traduco. Is there any other treatment that you advise your patients to use during your K-Laser course? So like probiotics or topical treatments that they can use at home?
Sì, beh, probiotici li posso consigliare e anche trattamenti topici. A volte, spesso facciamo fare un esame culturale per poi associare un trattamento topico mirato.
Okay, so yes, again, depending on the severity, he certainly advised to take probiotics to reinforce the immune system. And if the case is particularly severe, they can do an analysis of the cellular culture to understand what kind of fungus it is, so that topical treatments can be applied by the patient between laser sessions. Qualche esempio di prodotto che consigli di usare?
Topici ultimamente sempre spesso a base di itraconazolo, clotrimazolo.
Okay, so he has done
Amorfina.
Morphina. So I am going to, I will have to translate these compounds for you. I asked what are the products he likes to use, and I just need to translate them in English. I'm not familiar with them personally. So mi può ripetere per piacere? Sono quei tre che hai detto?
Amororfina, adesso te lo trovo anche.
Ciclopiroxina.
Cyclopyroxine e
amororfina.
And amorphine.
Amororfina in inglese ve lo dico subito un attimo.
E trattamenti itraconazolo.
Itraconazole.
E allora in inglese è amororfine.
Amorphine.
Attenzione, amororfine.
Apologies, as you know, I'm not a podiatrist myself, so I'm translating and I'm learning with you today. So yes, these are the products the compounds he likes to use. He may advise the patient to use in between treatments, and but as I said, we are going to write all these down, and I'm going to provide you with the exact names. C'è altro che vuoi aggiungere in base a casi particolari che ti vengono in mente, o altri prodotti o trattamenti che ti viene in mente, che ti è capitato di usare? O consigli, se hai consigli di qualsiasi tipo per l'onicomicosi?
Uso poi degli stimolatori ungueali per la crescita ungueale.
Okay,
delle gocce onicotropiche.
So he may use onicotropic treatments as well to stimulate the regrowth of the toenail. And the success rate of the treatments obviously depends on the severity of the case, but on the general health of the patient, on the general conditions of the patients. But yes, it's very much with onychomycosis. There is a lot of variation between individual patients, but he typically has very good success rates. Quindi il tuo livello di successo è piuttosto alto con i pazienti che tratti con l'onicomicosi?
Un buon 80%, sì.
So his success rate treating onychomycosis is 80%. So and as we said, you combining K-laser and other treatments like filing the nail correctly and advising for proper care toenail care and then stimulators. C'è altro che vuoi aggiungere?
No, buon lavoro.
Grazie tantissimo. Allora, anche qui noi abbiamo finito le domande.
Bisogna usarlo tanto per imparare a usarlo.
Un'ultima domanda appena arrivata. Once cleared of mycosis, can the nail grow following be damaged from the laser treatment, or will the nail grow normal? So, dopo il trattamento l'unghia crescerà normale dopo il trattamento laser, o appare danneggiata in qualche maniera dal trattamento?
Un po' traumatizzata può apparire.
So the toenail can look a little traumatized after the treatment.
Un po' ondulata.
It might be not perfectly smooth, it may be a little bit wavy, and so that can happen. Quando tu vedi il fumo che esce dall'unghia, quanto tempo passi a trattare con l'High Energy Head? Quanto tempo passi a trattare con la testa ad alta potenza? E soltanto quando vedi il fumo, o anche quando il fumo non esce? Allora, scusa, sono due domande in realtà. Quanto tempo passi ad usare la High Energy Head? How much time do you spend applying the High Energy Head treatment?
Il tempo come dire,
per essere sicuri.
Cercare di riempire tutta la superficie.
Ok. So,
in base alla superficie, cioè almeno una passata, come si dice? Sì. Almeno un giro su tutta l'unghia, in poche parole.
So with the high energy head, you simply must be sure that you didn't miss any spot in the infected area and obviously in the surrounding area. So you just, you will treat for as long as it takes to ensure that the treatment was even all around the toenail. And that you did not miss any spot, which is also the reason why you need to repeat the treatment 3 times on in the first course, because you must be sure that you did not miss any spot in the infected treatment. Otherwise, in that spot, the infection will survive and will spread again. So practice is really fundamental. You will get better in the treatment of onychomycosis as you practice the treatment over and over. E la seconda domanda è, sappiamo che quando usi la terapia ad alta energia si forma del fumo, ma se il fumo non si forma, continui a trattarla uguale o decidi di rimuovere l'unghia?
Posso continuare a trattarlo, non è necessario.
Anche se il fumo non si vede. So he confirms that even if you don't see smoke coming off the toenail, do continue with the treatment, because the smoke is formed when the infection is very superficial, but when the infection is more deep-seated, you may not see smoke coming out, but that doesn't necessarily mean that the treatment is failing. So even if you don't see any smoke, please continue the treatment. Quindi anche se il fumo non esce, continuare comunque il trattamento.
Sì.
Insomma,
minore effetto, ma...
Of course, if you see smoke coming off, you know 100% that the treatment is working. When you don't see it, you don't have that feedback, and you might have less chances of success, but nonetheless, do continue performing the treatment. Okay. If there are no more, oh, okay, sorry, there's another one. Have you avulsed badly infected nails and then just use the therapeutic head treatment to the toenail bed area to clear new nail growth? Sì, ti chiedono, hai mai trattato, rimosso l'unghia e poi usato soltanto la parte terapeutica? Sì, la risposta è sì, ovviamente. Yes, absolutely. You to perform toenail avulsion and you just use the therapeutic head, the therapeutic protocol for onychomycosis over the toenail, and then you repeat it all around the toe and the metatarsal area. Quindi sì, la risposta è sì, ovviamente. Togli l'unghia e poi prosegui con la terapia. Ok, ti lasciamo andare, sappiamo che il prossimo paziente è arrivato. We let you go, we know that the next patient has arrived and you have a very busy schedule. Thank you very much for allowing us to see your treatment. Grazie infinite.
Thank you. Vai.
Ciao
Thank
Antonella.
A presto.
Ciao a tutti. A presto.
Grazie Cristina. Thank you so much. Thank you very much for Grazie Massimo. Thank you so much. They will leave us now. E io continuerò con loro se ci sono altre domande, va bene?
Certo, va bene, grazie.
Puoi tranquillamente andare. Thank you guys. They are leaving now. I will be connected for a little longer if you want. If there is any other question you wish to ask, please do. They are going to, they will turn off the camera now. And I don't see any other question coming in. So we can finish here. As I said, we are going to update the guidelines for the onychomycosis and verrucas treatments as we find new ways to perform these treatments. I have already sent to all of you the guidelines for the correct use of the laser for onychomycosis and verrucas. Please bear in mind that this treatment will improve over time. We are pioneers here in improving this treatment modality. So as we discover new tricks, new strategies, we will update the guidelines and we will send them all to all the podiatrists using the K-Laser. So make sure that you always use the latest guidelines as they come as we send them to you via email. Should you have any question, please do not hesitate. Get in touch. It's always better to ask questions and receive guidance than just improvise. At the same time, if you do work out a new strategy, by all means, please share it with us. Let us know how you perform your treatments, how the little things that you learn only through experience, and we will then share it with all other podiatrists in the UK and around the world. As you know, the K-Laser is a community. K-Laser community is very much interactive. We want clinicians to grow together. So do not hesitate telling us what is your strategy, what are your considerations, what are your suggestions, and we will use them to integrate the guidelines. If you have any nice case study to share, please do. We will be delighted to receive you, to see your success cases. And in return, we will send you some free marketing materials that you can distribute to your patients. And we will be happy to feature you on our website to advertise your clinic as much as your treatment strategy. So should you have any question, do get in touch and we will send you the final editing version of this advanced training session once it will be completed. Thank you very much for joining us today and happy lasering. Goodbye. Thank you.